What if symptoms like tingling, burning, or itching aren't a mystery, but a message from your nervous system? And what if the reason they haven't resolved yet has less to do with damage and more to do with how your brain is responding to stress? I'm Madeleine Lowry, a neural retraining specialist, and if you've been following the recent episodes on chronic pain, today's conversation is a continuation of that theme. I want to talk about symptoms that are often just as distressing as pain, sometimes even more unsettling, but don't always get talked about in the same framework. Symptoms like tingling, burning, itching, numbness, pins and needle sensations, trembling, or unexplained weakness. These are often grouped together under the term neuropathic symptoms. And what I want you to know right from the beginning is this. Everything I've been saying about chronic pain and the nervous system also applies to these symptoms. They are not fundamentally different processes in the brain. As always, I want to be very clear that your symptoms are real, they are not imagined, and they certainly are not all in your head. But they are sensations that are generated and interpreted by the nervous system. The brain decides how loud the signal is and how persistent it is. And that is true whether the sensation is pain, burning, tingling, itching, numbness, or weakness. This is why symptoms can persist, even when tests are normal, or why they can shift, migrate, fluctuate, or intensify with stress. Many people with neuropathic symptoms have done everything they're supposed to do. Dermatology and neurology visits, imaging and nerve studies, medications, supplements, creams, procedures. Sometimes something shows up, but often nothing does. And yet the symptoms continue. That pattern tells us something important. When symptoms don't follow a clear structural explanation, the nervous system itself may be playing a central role. One example that I remember from my practice is a woman who came to me with chronic itching that she had lived with for 3 decades. She had seen specialists. She had tried medications, topical treatments, dietary changes, everything. Nothing had touched it. What was striking was that the itching had no consistent external trigger and would worsen during periods of emotional strain. We worked together using neural retraining, focusing on calming the nervous system and addressing the subconscious stress patterns. And after 4 sessions, the itching resolved. This wasn't because we had treated her skin differently. It was because the nervous system no longer needed to express distress through that symptom. The nervous system's job is not about comfort. It is about survival. If it learns early in life that the world is overwhelming, unsafe, or unpredictable, it can remain in a heightened state of vigilance. In that state, sensory nerves become hypersensitive, and this can show up as burning or electric sensations, tingling or buzzing, itching without a skin cause, numbness or weakness that comes and goes, or trembling or internal vibrations. These are signs of a nervous system stuck in threat mode, not necessarily nerve damage. Another case I want to mention is a man who developed chronic tingling and trembling in his arms and hands during the height of COVID. He had experienced several traumatic events during that period, intense stress layered on top of isolation and fear. Medically, nothing explained the severity or persistence of his symptoms. In our work together, we focused on those unresolved stress responses stored in the nervous system. And after 2 to 3 neural retraining sessions, the trembling and the tingling resolved. His nervous system was no longer on high alert. Most people with these symptoms also report anxiety or panic, hypervigilance to bodily sensations, fatigue and brain fog, or poor sleep. This is not coincidental. The same limbic brain circuits involved in emotional stress also influence sensory processing. When emotional load has nowhere to go, when it's managed, suppressed, or endured, the body often carries it instead. Neural retraining works with the subconscious patterns that govern threat perception, sensory amplification, and habitual stress responses. It does not require you to identify a single cause. It does not require reliving all of your trauma, and it is complementary to medical care or anything else that you are doing to support your health. Neural retraining helps the brain to relearn that it is safe to be safe. And when that happens, symptoms often soften, occur less frequently, lose their intensity, or resolve altogether. This is the same mechanism that we see with chronic pain, and it applies equally to neuropathic symptoms. These symptoms are especially frightening because they feel unpredictable, and fear itself can reinforce the nervous system's alarm response. This creates a loop where the sensation inspires fear, which inspires increased vigilance, which reinforces the sensation. Over time, this cycle or this loop can become self-reinforcing. Neural retraining helps interrupt this loop by changing how the brain interprets the sensation or the threat. Let me emphasize that neural retraining is not about ignoring medical treatment options. It is not about denying physical causes, and it is not about forcing symptoms to go away. It is all about working with the nervous system in a supportive manner when symptoms have become persistent, unexplained, or disproportionate, especially when they fluctuate, move, worsen with stress, or just don't match test results. If you've been listening to the pain episodes and wondering, does this apply to my tingling, burning, itching, or numbness? The answer is yes. These symptoms live in the same neural landscape. You can sign up for a free phone consultation or take our free quiz to learn if neural retraining could be your next best step at tcneuralretraining.com. I work with clients all over the world in private sessions via Zoom video conference. And if this episode resonated with you, please follow the podcast, leave a review, or share it with someone who needs to hear it. Thank you for listening today, and remember, when you change the patterns in your brain, you open the door for healing. Content of this podcast copyright 2026 by Twin Cities Neural Retraining. Music by Barbara Ben.